we have many symptoms. We have many mental illnesses, and I would like to start from defining or describing what mental health, is all about. Then I can come down to the various mental health conditions and their symptoms. I hope time will permit us. I won't make it too long, but our mental health is just basically the state of our minds, the health of our minds, the condition of our minds. And our mental health covers many different areas: the way that we think, our thinking, the way that we feel, okay, the way that we act or behave, and the way that we relate to others. So these are the four general areas that our mental health covers. Our thinking, our feelings, our actions or behaviors, and then our relationships. And if you know anything about your day, a typical day, this is what we do all day long. So we actually practice mental health all day long, right? Now, mental health affects the way that we cope with the stresses of life. Life is stressful. Life is challenging. There are circumstances that are being brought to bear on us on a moment by moment basis. And our mental health determines how well we're going to cope, how well we're going to perform or perform at our jobs, perform at home, our parental duties and all that, how well we perform and how fruitful we will be, even spiritually. How fruitful a Christian is going to be will be dependent on that person's mental health. And then our ability to make a meaningful contribution to community and even to accomplish our destinies. All of this is dependent on how healthy we are mentally. Now, so mental illness is anything, and I want to stress something here. It is any medical condition. We want to disabuse our minds of what mental illnesses are. They are medical conditions, just like we have hypertension and diabetes and all that. Whether it is diagnosed or not diagnosed, whether we admit it or not, whether we've identified it ourselves or not, any medical condition that affects the things that I've talked about, our thinking, our feelings, our behavior, and our relationship with others. Globally, one out of every four people will be affected by mental illness during the course of their lifetime. 1 out of every 4. So it is a huge concern, global concern, and it's not something we can just shrug under the carpet and move on with our lives. We need to pay attention to our mental health. Now, there are many kinds of mental illnesses. We have several categories, and you mentioned depression and anxiety. Depression and anxiety belong to the group of mental health conditions called mood disorders. Yeah. And we have depression, anxiety, PTSD, which is post-traumatic stress disorder. We have bipolar disorder, all of that in that large group of conditions. And they are the most common and the ones that we are most familiar with, okay? Now, I can go into some of the symptoms just to help anyone who is out there and you're not too familiar with depression, you're not too familiar with anxiety, you're not too sure what is going on in your life. Before I even go into it, I want to say that if you are in doubt, please seek professional help. Talk to someone. There should not be any shame. It's just like when you break your leg, right? Sure. If you break your leg, if you fall and get hurt, you get a fracture, You don't sit at home and say, I guess it will be fine. I guess nothing is going on. If you are in doubt, you want to talk to a professional just to clear your mind, just to be sure of what is going on.